Guys, we're going to hop into some look at the science of the medicine of running. At HSS, we do a lot in running medicine, and in my practice, particularly a lot on running medicine. So I wanted to give you 10 minutes on kind of current strategies to think about running, then running prevention. Then we are going to hear from Polly DeMille, who is, among other things, the director of our performance center and an exercise physiologist, talking about can you actually make yourself a faster runner? And then we're going to have a great panel discussion on current trends in the science of making yourself a better runner. So we're going to start with a discussion about strategies for injury-free running. So who are runners? That's a great question. Who in here runs? Let's see. Oh, that's pretty awesome. All right, so this room are runners, and we see runners of all different ages and speeds, but you're all out there moving. When we look at the demographics of who runs, runners are basically, in this kind of recent study done last year, 63% female compared to 37% male, 28% between the ages of 35 to 44, 27% between the ages of 45 to 54, 68% of runners are married, 20% are single, 8% are divorced, just as kind of a show of hands. Just got to look at the demographics of who runs. Why do people run? People run for exercise. They run for questions about their weight. They run because they've been encouraged. They run because they have a goal, like entering a race. And they continue to run because they want to stay healthy. They want to stay in shape. They want to relieve stress. And they want to train for a particular race. Now, why do people run and what distances? Well, basically, we've seen a real growth in all running, but particularly in the half marathon, which has increased more than 43% in the past several years. A lot of interest in half marathon. Who ran the half marathon this past weekend? About a quarter of the room. Great job. And runners are different. When you look at some of the great ad campaigns around runners who run uphill instead of taking the trolley, who stretch at the airport, who do this instead of sit on the bench, who think this is completely normal behavior, and who have no problems doing this. Runners are a different patient population in general, but in general, I want my patients to run. When I first started at HSS in our sports medicine conference, people would say the patient is at 30, we do case presentations, this patient is a 36-year-old person, and she's a runner, or he's a runner, which is code name for they're crazy. And I don't feel like that's true at all. I think runners are awesome, and I feel like over time we've really recognized how amazing runners are for thinking about preventive health. So no matter how fast you go, no matter what you're doing, we want all of you to run. Now, as Nir was talking about, there is some great data on the correlation between being active and movement in general. This is a study that was published in Cardiology, looking at people who were coming in for treadmill testing and looking between the years of 1991 and 2014, if what their fitness test was on a treadmill correlated to their health. So this is a pretty big data collection series. 122,000 patients. About 60% of these were male. They were followed for about 9 years, looking to see as if they were more fit, did that mean they were more healthy? And they were kind of divided up into age and into male and female groups. And the conclusion was that the more fit you were, the better your life expectancy and the healthier you would be for longer years. And more importantly, there was no such thing as an upper limit. So Judy out there doing burpees in the mud is actually, in terms of this study, helping her as the ways we will see. So this is a little bit small, but to look at this, they looked at different groups. And here we have the low fitness group, the below average fitness group, the above average fitness group, and then the elite fitness group. And they broke that down by ages, looking at, among other things, their BMI, their body mass index, which went down as they got to be more fit. Looking at their disease risk, diabetes, hypertension, hyperlipidemia. All of these issues went way down as they became more and more fit over the course of their fitness. Also medications such as beta blockers, which many people are on statins to lower cholesterol, all diminished in frequency when we got out to higher levels of fitness. They also looked at ages of patients and tried to figure out, so somebody who is over 80 years old, what's their relative level of fitness? Polly's going to talk to us about becoming the best fit athlete you can be, but that's very different if you're 50 versus when you're 60 versus when you're 70, which is why when you were running up 7th Avenue from Times Square, you said, God, this was a lot easier 10 years ago, because it probably was. You have to work a lot harder to get the same amount of output. But the most interesting part about this was comparing the elite versus the high. So high fit versus elite fit. Not only did people have higher health markers when they were elite fit, but even if they had disease in every age group, if they had diabetes, if they had hypertension, if they had hyperlipidemia, they had basically increased health behaviors, and they were healthier if they were elite fit versus if they were fit. So there's no such thing as an upper level of fitness, which is why we want everybody out there moving and exercising on a regular basis. So anybody from Florida here? A couple of Floridians. This is Lake Nona near Orlando, and this is a new kind of test area where they're basically taking in families, and they are putting people into, what was the movie where they had like it was like a total perfect society and everybody was studied? Truman Show. Truman Show. This is kind of like the Truman Show. And what they're doing is looking at all the metrics of what makes people healthy, what they eat, what they do, their societies, all these things, looking prospectively at what things make people healthy. We know that runners live longer than control. Studies have been done looking at runners in longevity, and basically runners average of 6.2 years for men, 5.6 years for women, for a number of factors, but running is basically great for you. But in my office, I like to think about how we can keep runners healthy, and here's kind of a classic story that somebody would come in with. They would come in saying, Dr. Metzl, my hip hurts. Typical patient visit. I'm doing an accelerated marathon program because I'm a New Yorker and I just got, I have no time for anything. I'm going to push through the pain no matter what I am doing. I see Sandy nodding her head there. I don't care if it hurts. I can do this. And lo and behold, they end up with this, which is a stress fracture in the neck of their femur, which is a terrible injury, which can totally change your activity profile for months and months and months, sometimes need surgery. These are self-inflicted injuries by not listening to the cues of your body. So what makes people healthy runners, and what can we start to think about in terms of figuring out how we want to get them to start moving? Things like how long their stride is. We're big into getting people to shorten their stride, minimizing their arm string and their up and down movement, keeping them lower to the ground by shortening their stride and quickening their cadence. We want them to work on strength and nutrition and also recognizing aches and pains. We tell people that if an ache and pain is changing your mechanic of movement, you got to come in and get it checked out. Because runners are different based on ages and levels of things they're going to be doing, and they have different goals. Running has been studied for a long time. This is some work being done back in the 1800s. A French physician and physiologist named Marie was studying, is there a proper way to run? And he was looking at trying to photograph runners in 1880, looking at could they run, and was there such thing as a proper running form? And the answer is there's no definitive best way to run, but we think there are some things which we can impart to our patients to get them to run most effectively, including things like shortening their stride and quickening their cadence and lessening their ground reactive force, to really think about the different things that can help people maximize their efficiency, including their feet and their ankles, their knees and their hips. If you have arthritis in a different area or you're not strong enough, running is basically man or woman versus the ground. And you want to win that war for as long as you possibly can. And so these are some of the things we think about, as well as building up strength around your body. So a whole idea of kind of total body strength program, functional strength, our iron strength program being one, is all about building total body strength to help people win this war of man or woman versus the ground. The other piece is that the more you run, the more force you're putting across your body. So if your biomechanics are screwed up and you're walking, that's very different than if your biomechanics are screwed up and you're running. You're putting way more force, something 3 to 4 times more force running versus walking. And so that increased force puts more loading across your hips and your knees, which makes them hurt more. So in our lab, we start to look at the way people land. This comes out of our running lab at HSS, looking for people who might land as a forefoot striker, or a midfoot striker, or a rear foot striker, and trying to correlate who is the healthiest type of runner. And with all that information, what are the things we like to fix when people come in to see us with a running injury? Well, we'd like to start getting them to think about their kinetic chain, their tip to toe, how they land, how they take off, how strong they are. These are all things we can start to alter. We start to think about their feet, getting them in the right kind of shoes. Do they need an orthotic? Are they doing those types of things? Are they striding too long? Many runners overstride. We really work on trying to get them to shorten up their stride, and we try and develop the optimal training program so they can really stay out there on the road, as well as thinking about things such as nutrition and body strength as well. So with our patient coming in with a stress fracture in her hip, what are the things we want to think about? First of all, we want to get the right diagnosis. And the big mistake people make is they try and push like this person, and they don't recognize their body's response to pain. I see Matt smiling at me because he does that routinely, but he's been smarter about it. Every running injury has multiple causes, including things happening in your body, such as how strong you are, injuries you may have underlying, and external factors such as your training program, the surface you're running on. All these things really contribute to running injury. And our treatment really needs to think about both of those things when somebody comes in to see us. And at HSS, we've started a running program where we look at things such as our awesome friend Pam, who's here in the audience someplace, who has been running for 15 years, and she wanted to run a half marathon and wanted to beat me in the marathon. She's almost there, Pam, good job. And we want to start thinking about runners' intake and how we can start thinking about getting that going. So when Pam comes in, we want to think about what's happening as she kind of strides. What's happening to her hip height? Is she strong enough from back? Is she overstriding? Is she striding too long? We want to think about all those things as we start to think about maximizing her run mechanic as we think about what we're going to do with her. So to conclude, running is awesome. And I love that everybody in this room, many of you are all runners. You're here wanting to learn. You're oxygenating your brain. You're thinking about learning. I love runners' enthusiasm for all things. There's no one answer for every runner. And you want to listen to your body and pay attention. And we want to have smart, effective running mechanics and smart training programs as we think about making running fun for everybody. And with that, that is my 2 cents on the mechanics of healthy running. And now we are going to jump over. Thank you very much.